Okay, so good evening, everyone. I hope all of you are doing well. So today we are going to solve some MCQs on antiviral agent. Basically, we are going to cover the medchem part. Okay, so let's move towards the first question. Okay, so what is the first question? What are the unwanted effects, it means side effects of Zidovudine? So as we all know that the Zidovudine is used in the treatment of HIV. Okay, and it inhibits the HIV reverse transcriptase enzyme. Okay, but there are some side effects. It may cause blood-borne marrow problems, which includes the fever, chill, sore throat, pale skin color, or tiredness or weakness. But especially it shows anemia, neutropenia. It means the neutrophils count may get less, then nausea and insomnia. So these are the main side effects of Zidovudine. So the correct answer is option B. And for Zidovudine, there are some contraindications like the patient who are having low level of WBC, that is nothing but the neutropenia. So we can't use Zidovudine in that case. Even the person with liver problem, severe liver diseases, as well as the muscle inflammation problems. Okay, so for this question, the correct answer is option B. Let's move towards the second question. What is the mechanism of action of cytosine arabinoside? So cytosine arabinoside is a pyrimidine nucleotide antimetabolite. It is a pyrimidine nucleoside. The class of this drug is pyrimidine nucleoside antimetabolite. Okay, so intracellularly, this cytosine arabinoside gets converted into the cytarabine triphosphate. Okay, cytarabine. So from cytosine arabinoside gets converted to cytarabine triphosphate. Okay, and this cytarabine triphosphate competes with the deoxycytidine triphosphate, and because of that the DNA polymerase get inhibited and it results into the inhibition of DNA synthesis. So on this basis of mechanism of action, we can conclude that the cytosine arabinoside interferes with synthesis of DNA. As I said, it converts into the cytosine arabinoside triphosphate, which damages the DNA, and this also inhibit the DNA and RNA polymerases and nucleotide reductase enzyme, which are important for the DNA synthesis. So the correct option is option D, all of the above. Next question, chemically Vidarabine is. So first we will see the structure of Vidarabine, that is here is NH2. This nitrogen is attached with 5-membered ring with oxygen. It is having OH, OH and CH2OH. So this is the structure of Vidarabine. Okay, you can see this structure is having the adenine ring. Okay, out of all these options, the first option is having the adenine as the parent ring as a basic scaffold, whereas the second option is having guanine, guanine, guanine. So on this basis also you can conclude our answer, that is option A, 9D arabinofuranosyl adenine ring, because this is the adenine nucleoside. Okay. The next question, identify the nucleoside reverse transcriptase inhibitor with purine nucleus. Purine nucleus is what? This N is with one H. Okay. So this is the purine nucleus. This is the diadenosine. This is the abacavir, tenofovir, and adifovir. Okay. What they are asking? They are asking the drug with purine nucleus. All these four are nucleoside reverse transcriptase inhibitor, but you can observe that the diadenosine is having the purine nucleus. See, this nitrogen is not with hydrogen, even in this case, even in this case. Okay, so the correct option is option A, diadenosine. Next question, identify the structure of following drug. This is the structure. Okay, if you don't know the structure of all these four drugs, on the basis of the substituents, you can identify the structure, you can identify the drug. How? You can see there is one iodine. Okay, the first option is Idoxuridine. Simply you can get the answer on the basis of this. So the structure is nothing but the Idoxuridine. So the correct answer is option A, Idoxuridine. The next question, identify the non-nucleoside reverse transcriptase inhibitor NRTI, which work as an anti-HIV agent. So the first option is Delaverdine. Delaverdine is non-nucleoside reverse transcriptase inhibitor and it is against HIV. The next is Efavirenz. Efavirenz is also non-nucleoside reverse transcriptase inhibitor and it is also against HIV. Whereas Nevirapine is also a non-nucleoside reverse transcriptase inhibitor and it acts against HIV. So as per this, the correct answer is option D, that is all of the above. The next question, which point in the replication cycle appears most easily and it is blocked by antiviral? So nucleic acid replication, it means the replication of DNA as well as RNA is easily blocked by any antiviral compound. Okay, so nucleoside and nucleotide analog are the most easily discovered antivirals, especially for HIV as well as for HHV. Okay, so you can see the option C is virus, RNA and DNA replication. So they block by inhibiting the RNA and DNA replication. So the correct answer is option C, virus, RNA and DNA replication. Next question, famciclovir. What it is, how it works. So famciclovir is first converted into its active antiviral agent, that is nothing but the penciclovir. Penciclovir. So the active agent of famciclovir is nothing but the penciclovir. Okay, and this penciclovir is competitively inhibit the viral DNA polymerase. It competitively inhibit the viral DNA polymerase, not the herpes DNA polymerase, not the HIV reverse transcriptase, okay, not the viral protease. So the correct answer is option B, that famciclovir is inhibit viral DNA polymerase. Next question. The antiviral drug that is a thiazole analog is. Now thia, it means sulfur, and aza, it means nitrogen. So we will see which drug are having sulfur and nitrogen containing ring in that structure. So the first is nalfenavir. So this is the structure of nalfenavir. This one is the sequinavir. This one is the ritonavir. And this one is the loviride. What they are asking? Thiazole. OLE, it means five-membered ring. So which drug contain five-membered ring with sulfur and nitrogen? So you can see in this, there is no thiazole ring. Over here, no. In this case, see, five-membered ring with one nitrogen and one sulfur, that ring is nothing but the thiazole. It means that the antiviral drug which contains thiazole is ritonavir. Okay, so the correct answer is option C, ritonavir. Next question. Ganciclovir is preferred over acyclovir. Ganciclovir, acyclovir in the following conditions. So the topical ganciclovir. So ganciclovir is used topically. It is appeared to be more effective than the oral acyclovir. So the route of administration of ganciclovir is topical, whereas the route of administration of acyclovir is oral. In the following condition, so the topical ganciclovir is more effective than the oral acyclovir in the prevention of reoccurrence of hepatic keratitis. Why? Because keratitis is totally related with the hair and skin. Okay, so topical application of ganciclovir will be better as compared to the oral ganciclovir. Okay, so, and it is used in herpes simplex keratitis. Next question. The drug that can induce peripheral neuropathy and oral ulcerations. The options are acyclovir, zalcitabine, zidovudine, and sequinavir. So dideoxycytidine, that is nothing but the zalcitabine, is a nucleoside analog which is used as an antiviral agent, and it has been reported to cause the oral ulceration, the esophageal ulceration, as well as the peripheral neuropathy. Okay, so zalcitabine can induce the peripheral neuropathy and the oral ulceration as well as the esophageal ulceration. So the correct answer, correct option is option B. Next question. Zidovudine resistant strains of HIV can be treated with. So zidovudine resistant strains of HIV can be treated with dideoxycytidine, as we have learned in case of the 11th question. Okay, so the answer is option C, dideoxycytidine. The next question, which wing is present in the Nevirapine structure? So first we will see the structure of Nevirapine. See, Nevirapine is having, it is a tricyclic. Okay, NH over here, N, 6-membered with N. Okay, over here double bond O, and this nitrogen is with cyclopropene. Okay, so this is the structure of Nevirapine. The first option is diazepine. Diazepine, it means 2 nitrogen atoms. You can see 7-membered ring, INE. Oxazepine, oxygen and nitrogen. No. Phenazine, phenyl with nitrogen. No. Whereas oxime, no. So the nevirapine is having diazepine ring. Next question. Which of the following drug is a derivative of pyrophosphate? The first one is acyclovir. So acyclovir is the analog of deoxyguanosine. It is the analog of deoxyguanosine. Whereas the Zidovudine is the analog of thymidine. Foscarnet is the analog of pyrophosphate. Okay, and the Vidarabine is the analog of adenosine. They are talking about pyrophosphate analog, so the answer is option C, Foscarnet. Next question. What is the mechanism of action of Amantadine HCI? So amantadine is the weak antagonist of NMDA type glutamate receptor. Okay, and this amantadine HCl increases the level of dopamine release. If it increases the release of dopamine, it means it blocks the dopamine reuptake. Okay, and it inhibits an early stage in viral replication, most likely the viral uncoating, because uncoating it happens in early stage of viral replication. The after adsorption, the second stage is uncoating. Okay, so the correct option is option A, that they inhibit an early stage in viral replication, most likely the viral uncoating. Next question. What are the side effects of Oseltamivir? So Oseltamivir cause the severe abdominal cramp. Okay, and this abdominal cramp is suddenly belong along with watery diarrhea. It begins with the watery diarrhea, and that condition is nothing but the hemorrhagic colitis. So hemorrhagic colitis में क्या होता है? Abdominal cramps आते and it suddenly along with watery diarrhea. Okay, even this Oseltamivir also shows the Steven-Johnson syndrome. What is Steven-Johnson syndrome? It is a disorder of skin and mucous membrane. Okay, it is a serious disorder, not as a acute one. Okay, whereas the abnormal heart rhythm is also a side effect of the Oseltamivir. So all three are the side effects of Oseltamivir. That's why the correct answer is option D, all of the above. Next question. Idoxuridine effective against. So idoxuridine, as we all know, as we saw in previous question, they had given the structure of one compound and it is having the iodine, and we have concluded this is the structure of idoxuridine. It means what? This idoxuridine is the iodinated analog of what? Deoxyuridine. So idoxuridine is the deoxyuridine analog, and it is having the antiviral activity against the HSV, that is herpes simplex virus, and it is used for treatment of viral eye infections, which also include the keratitis, and how it acts by inhibiting the DNA synthesis. Okay, so out of these, HSV, that is herpes simplex virus keratitis, for this treatment of this, we can use idoxuridine, even for viral eye infection as well. The next question, identify the drug on the basis of the following structure. So this is the structure of which drug, how we can analyze. First is ganciclovir. First, we will talk about the what kind of analog all these. So ganciclovir is the guanosine analog. Okay, adifovir is the adenosine monophosphate analog. Adenosine monophosphate analog. Acyclovir is the acycloguanosine analog. Acycloguanosine analog. And the Vidarabine is the adenosine analog. Okay, now see clearly, carefully, you can see the guanosine nucleus in this structure. So on the basis of type of analog, you can conclude the name of this structure. Okay, out of these four options, the ganciclovir is the guanosine analog. So this structure is of ganciclovir. So for that, you should know what kind of analog is this. Like ganciclovir किसका analog है? Guanosine का. Only on the basis of that you can identify the structure. Okay. Next question. Chemically, Zidovudine is known as. So first we will see the structure of Zidovudine. Double bond O. Here is double bond O. Here is one methyl group. This is attached with this. It is having CH2OH and it is with triazine. That is N3. N double bond N like that. Okay. So as you can see, the thymidine ring is there in Zidovudine, as well as on third position. See, this is the first, this is the second, this is the third dash. So 3-azido, 3-deoxy. Why deoxy? Because in thymidine, here is OH, but it is replaced with N3. So deoxythymidine. Okay, so the IUPAC of Zidovudine is 3-azido, 3-deoxythymidine. Next question. Antiviral drug with no heterocyclic ring system. Heterocyclic, it means the cycle should contain at least one heteroatom. It means other than the carbon atom. So we will see the structure of all these four drugs. This is the loviride. This is the nelfinavir. This is the troviridine. And this is the zidovudine. Okay. What they are asking? The drug with no heterocyclic ring. You can see in loviride, 2 benzene ring. In nalfenavir, benzene ring is there, but it is having the heterocyclic ring as well, because this ring is having nitrogen. In this case, it is having 1, 2 heterocyclic ring. In this case, it is having 2 heterocyclic ring. But they are asking about drug with no heterocyclic ring. It means the answer is option A, loviride, because benzene is not a heterocyclic ring. Okay. So the answer is option A, loviride. Thank you so much.